Today's guest, Dr. Hunt Allcott, had two recent papers with colleagues Benjamin Lockwood and Dmitry Taubinsky on whether soda taxes are effective and how an optimal soda tax might be established. They were published by the National Bureau of Economic Research. These are important papers at an important time given all the activity around the world on soda taxes. I'm Kelly Brownell, Director of the World Food Policy Center at Duke University and Professor of Public Policy at Duke. Welcome to the Leading Voices in Food. Hunt Allcott is a principal researcher at Microsoft Research, an associate professor of economics at New York University, a research associate at the National Bureau of Economic Research, and a co-editor of the Journal of Public Economics. Hunt, I'm so pleased to have you join us and would like to begin with a key question based on your work. What are the key ingredients for calculating the economically optimal soda tax?
It's a great question, and thank you so much for having me on the program. I'm a big fan of the program, and I'm a big fan of the work that you're doing. The key ingredients for calculating the economically optimal soda tax, I would say, are actually the key ingredients for thinking about the optimal policy in any number of domains. And so there's a subfield called public economics that has a framework for thinking about this. And it is a utilitarian framework. It starts with the idea that everybody is maximizing their happiness, possibly making mistakes in doing so, but they're trying to maximize their happiness or utility. And there is a benevolent policymaker or government that's trying to do well by its citizens, that's trying to maximize the sum of happiness across all people, and you might call that social welfare. So that we think, the way that we think about lots of economic policy problems, setting optimal taxes on sugary drinks, but also tobacco taxes or income taxes or disability insurance, is from this perspective of a benevolent policymaker that's trying to maximize social welfare. And so what does that framework specifically then say for what are the key ingredients for an optimal soda tax? I think the two key ingredients are really what share of health costs that are caused by soda consumption, what share of those costs are borne by other people. And then in what you might call internalities, are we making some mistake? Are we failing to maximize our own happiness by drinking too much soda, possibly because we don't know how bad soda is for us, or because we have self-control problems? Building on those two key ingredients, you in general want to impose a corrective tax on tobacco or sugary drinks or carbon pollution or anything else, if and only if the consumption generates externalities or internalities. We, in our paper, calculate what we think is the economically optimal tax rate. And for a nationwide tax, our calculation is that somewhere between 1 and 2 cents per ounce, actually, it would be the optimal nationwide tax rate. And so there's a sense in which the cities are actually pretty close to the optimal tax that we would set nationwide. And these calculations are speculative. There's a whole, industry of economists and public health folks that are thinking about, what would be the optimal tax on carbon pollution or the optimal tax on tobacco. And this is an early attempt at setting that optimal tax in the context of soda. And so we've done our best, and I think there's more work to be done there to try to figure out what the optimal amount is. You may have noticed that I was a little bit careful in distinguishing between the optimal nationwide tax versus the taxes that are being set in different cities. And that's actually a key distinction. Most of the taxes, in fact, all of the explicit soda taxes that we have are at the city or sometimes the county level in the U.S. And when that's been done, there are some papers that document what economists call leakage. In other words, that when you tax soda in Philadelphia, people when they're shopping outside of town start buying more soda outside of town. Similar things seem to be happening in Berkeley, and I imagine they're happening in other cities that have soda taxes. This leakage reduces the effectiveness of the tax. It's basically you're taxing one good, which is soda in Philadelphia, and demand for another harmful good, soda outside of Philadelphia, rises. And that means that the optimal level of the tax is lower and the effectiveness of a tax at any given rate is lower. And so it does mean that the optimal city level tax, taking into account leakage, is certainly lower than the optimal nationwide tax that you would set.
And what are the ways in which soda tax design can be improved?
The most common structure of soda taxes in the US is that you would tax at 1 cent or 2 cents per ounce of sugary drink. Now, of course, sugary drinks vary in the amount of sugar that they contain. Soda pop has more sugar per ounce than, some other types of SSBs. Some types of iced tea, for example, have less sugar per ounce. But it really is that sugar that's causing the harm to our health. And so we would advocate, and some countries have started to do this, that you set a soda tax that scales with the amount of sugar in the drink, not the amount of liquid that comes with the sugar. And in fact, our team is working on a paper to sort of quantify that point, and other people have made that point as well. So that's one example, and there are others.
And given this work, do you think soda taxes are effective public health policy?
Yes, absolutely. Absolutely. So one is that it would cause consumers to, even if they like some kind of sugary drink, it causes consumers to substitute to less sugary drinks. That's good for their health. And the other benefit is, as you say, on the production side, it will induce faster changes in the product space. It certainly seems like, the benefits of a tax are not just that price goes up so demand goes down, but indeed what people infer, what information people start to sense that they're getting from their government about the types of things that are being taxed. And as an example of this, you may know that there's a paper by Alex Rees-Jones and Kyle Razuma that is circulating recently that looks at cigarette taxes. And they look at cities that debated, but in the end did not pass cigarette taxes. So there was no impact in these places on cigarette prices, yet there was a lot of coverage about the health harms from cigarettes. And there seems to be some evidence that people's cigarette consumption in these areas actually went down in response to these debates. And so I think that's clear evidence that the benefits of taxation are not just through the price channel, but they're also through the sort of public debate and information channel.
You also have another line of work on food deserts and have published impressive work on that topic. How much effort do you believe we should put into combating food deserts by subsidizing grocery stores in underserved neighborhoods?
It's a great question, and yes, it is something that we've been interested in. We've just had a paper accepted at the Quarterly Journal of Economics that touches on this issue. And we got interested in this because we've been reading about food deserts and reading about nutritional inequality, just the idea that low-income folks aren't able to eat as healthfully as high-income folks, and also the fact that low-income neighborhoods often have more convenience stores and fewer healthy grocery stores with fresh produce. This sort of correlation, this connection between lack of healthy supply and lack of demand for healthy groceries might have been sort of a causal thing where the food desert is causing the lack of demand for healthy groceries. And so we were interested to try to find out if that was actually true. When new grocery stores open up, does that actually impact does that actually cause people nearby to buy healthier groceries? And so we looked at this. We gathered Nielsen HomeScan data, and we combined that with data on all the grocery stores that have entered in the United States over the last 15 years or so. And it turns out that when grocery stores enter in food deserts, they don't cause people to eat healthier food. So what does happen is that people shift their shopping towards the new supermarket, but they don't buy healthier food. And I think this is, I think, an important fact. And when we think about why we'd want to subsidize grocery stores in underserved areas, I think that this is an important fact to take into account. It doesn't seem to have much of an impact on healthy eating.
Hunt, thank you for being a leading voice in food, and please know how much I appreciate you joining us today.
Thanks for having me.
Our guest has been economist Dr. Hunt Allcott, and thank you for listening. If you would like to subscribe to the Leading Voices in Food podcast series, you may do so at Google Play, Stitcher, Radio Public, or Apple Podcasts, or by visiting our website at the Duke World Food Policy Center. This is Kelly Brownell.